Okay, let's start by defining what psychosis is. It's a mental health condition that creates hallucinations, and sometimes an individual may not actually understand or really see vividly some of the voices that are not there. Sometimes they experience, hallucinations in different perspectives. So what You Belong Uganda is doing this time around is to look for people who have been affected with psychosis and have recovered, to also do the same, replicate to other people who have this particular challenge. So they have started this initiative that is aimed at connecting these individuals to speak about this issue, but also to help the victims or the people who are suffering with this challenge to address it. And for now, let me start with Dr. Byamah Brian, who is the deputy CEO at You Belong Uganda and one of the chief investigators in this particular project, to paint a picture for us how they came up with this idea. Dr. Byamah, thank you so much for joining us. Why connect the recovered patients with those going through the process or the challenge of psychosis? Let's start from there.
Thank you. And what informed our thought behind this study was that the evidence shows that working with people with lived experience of a condition actually supports them in their recovery. And we thought about how best can we do it. So the SCAPE-U study was about how do we work with individuals who have been supported through recovery that are living with psychosis to work with professionals, so that there is a collaboration between professionals and persons with lived experience who are experts by experience, and then they're experts by professionals. How can they work together to improve mental health services?
How has it been for you in this particular program? How have you found these connections between the recovered and those that are suffering with the challenge?
For us, the biggest learning is that the power of lived experience. When someone shares a lived experience with you, it contributes a lot to their recovery, because you actually see the journey that you are able to walk even when you've just become unwell. It gives a lot of hope to both the individual and their family to know that even if I have developed these symptoms, even if I have suffered this illness, which is highly stigmatized, which for many people means that their life has ended, there is an individual who has actually lived through it, recovered, and is making meaning out of their life. And that's for us the biggest learning, that we can actually work with them to improve mental health services for those who are just getting affected now. And also, how do we work with them to support with the professionals at different levels, primary health care level, village health team members, so that the mental health system can go on to start working with persons with lived experience routinely.
You're also using photo voice concepts to train or to implement this particular project. How are you doing this? Define for us what photo voice is.
So photo voice is about using photographs accompanied by a narrative. And so in the case of SCAPE-U here, we worked with these individuals with lived experience of recovery from psychosis to take pictures which depict their recovery journey. They take pictures in the environment, like you must have seen, which show when they fell sick, when they started their journey of recovery, then when they are better. And it is a powerful tool. It was the mode of delivery for the SCAPE-U facilitators, some of whom the illness has affected so much that they cannot communicate just using a narrative.
Doctor, maybe lastly, we cannot live here without talking about stigmatization, one of the challenges that most of the victims have talked about. Please comment on this stigmatization and how we can change this.
So this is what our study shows. And like we showed, that one of our biggest findings that those who were supported by SCAPE-U facilitators actually showed reduced stigma compared to those who did not receive interaction with SCAPE-U facilitators. Stigma is the biggest obstacle to recovery for patients with mental illness. And the best way to address stigma is work with individuals who have lived through the illness, because that social contact, that engagement helps people understand that you can recover from mental illness. Thank you.
Yes, so the main theme here, Tracy, is that we are using people who have lived experiences, who have gone through challenges of mental health challenges, to ensure that they change the narrative, but also train others to be able to recover from the same. I'll be giving you more details in a subsequent bulletin. Back to you.